I call the honourable member for Bowman.
Thank you, Madam Speaker. A question also to the Minister for Health. Will the Minister advise the House what steps the government is taking to ensure that the best medicines are available for Australian patients?
I call the honourable Minister for Health.
Thank you very much, Madam Speaker. Can I thank the member for Bowman for his question, recognise his expertise and his input into health policy, and also recognise the Prime Minister's commitment and mention to the $1.3 billion listings of new medicines and vaccines in this year's budget that will save lives and improve the quality of life for thousands of Australians. Tuesday's budget listed new drugs to help beat breast cancer, Perjeta and Herceptin, melanoma, Mekinist, and extended indications for eye disease, most relevant to the member for Bowman as an eye specialist, the drug Lucentis. The government will also extend free vaccinations for the debilitating shingles virus to older Australians aged 70 to 79 by listing it on the National Immunisation Program. Madam Speaker, this is part of our commitment to ensure that Australians have access to affordable medicines as and when they need them. But with listings approaching $50 billion over the next 5 years on the Pharmaceutical Benefits Scheme, it's imperative that taxpayers, and by extension governments, make this money available for life-threatening diseases and our responses to them. We have 29 new and amended listings per month on the PBS compared to Labor's 8 listings a month. It was part of our election commitment that when drugs pass the PBAC, they get listed as expeditiously as possible, and we are maintaining that. But with more and more drugs in the pipeline, it becomes vital that we keep the PBS sustainable and that it continues to grow at a sustainable rate. Because in addition to the $1.3 billion in new drugs that I've announced, there is $3 billion in new recommendations on the table. Negotiations across the whole of the supply chain for medicines have been positive, proactive, and have had patience at the table the whole way through. But where this leads, Madam Speaker, and no one would ever want to be political about an issue to do with life-saving drugs, is that we must have the savings. We must manage the budget responsibly. We must, as the Prime Minister said, invest and continue to invest. And with $2.3 billion in added expenditure across the health portfolio, that's important. Where is Labor's plan for saving? It's nowhere. In this year where 1,000 good ideas were going to bloom, the only thing that Labor has said, that the opposition spokesman has said, is that cuts could be made across the system wherever they are found. There is nothing in the health landscape. There is no idea from Labor about how to manage this problem, how to keep patients and doctors and the community at the centre of the healthcare system, and we maintain our responsibility.